Up Close with Chris Williams is presented by Tennova Healthcare, with 6 hospitals and more than 1,000 dedicated physicians. For more information, tennova.com.
Welcome to Up Close. I'm Chris Williams. The number of individuals having weight loss surgery continues to grow, not only in the United States, but throughout the world. Last year, more than 200,000 people had weight loss surgery in the United States alone. Dr. Stephen Boyce has been performing weight loss surgery for more than 20 years. Though a native of Texas, he's been a Tennessean now for many years. I first asked him about his younger days and what led him to practice in Tennessee. First of all, I wanted you to tell our viewers a little bit about yourself and maybe where you grew up.
Sure. I was born and raised in Dallas, Texas. Went to college down at Texas A&M, who's new to the SEC now, and didn't have too bad a showing, I thought. I did my college work at, as I said, at Texas A&M. Went to medical school in Dallas at the University of Texas Southwestern Medical School, and stayed on there to complete my general surgery residency at Parkland Memorial Hospital.
At what point in life did you determine, I want to be an MD? When did that first interest occur?
Well, I remember I was a freshman in high school. A buddy of mine and I were walking down the hall kind of talking about what we might want to do with ourselves, and he said, well, I think I'm going to go into medicine. I'm going to be a doctor. And I said, me too. And pretty much from then on, he and I were the best of friends, and we kind of had that approach all through high school, and he's a gynecologist living in Dallas, Texas right now.
Very interesting.
Yeah.
So kind of a pact that you made at a young age and you kind of held to it. Yeah. What about specializing in the weight loss surgery? Was that something that while you were working on your undergrad degree and your residency that you were interested in, or did that kind of, you happen upon that along the way?
It really kind of happened upon it along the way. When I was in Dallas doing my general surgery residency, there was one of the grandfathers of bariatric surgery there named Otto Wilbanks. And he offered to come over to Parkland and train the residents in weight loss surgery if they had an interest. Well, in my group of 10 chief residents, there was only 2 of us who had an interest, and we lined up a few patients, and Dr. Wilbanks came over and assisted us in operating on these patients. And then I had an opportunity to follow them for 2 years before I completed my residency. And it was just amazing the change in their lives. And I think my friend and I both were very impressed by that, because he also does exclusively bariatric surgery now.
So what transpired to get you to Tennessee? What brought you here?
Oh yeah, well, as I mentioned, I trained at Parkland Memorial Hospital in Dallas. And as I was winding up my residency, I got a call from a surgeon here in Knoxville who had trained in Parkland about 17 years before, and he was looking for some help. So we started a dialogue, and he was just an exceptional person and surgeon, and I came up here to practice with him.
Let's talk about severe obesity, which a lot of people may not know. It is a chronic condition.
Yes, it's a lifelong illness.
And tell me about what is involved with it, the characteristics of chronic obesity, and anything that people at home might want to think about in considering whether or not they have that.
Okay. Well, severe obesity is a distinct medical definition. We define it based on a calculation that we do called the body mass index, or the BMI, which is just a calculation so that, for example, a healthy weight individual would have a BMI of 20 to 25. If you're 25 to 30, medically speaking, you're overweight. Obesity begins at a BMI of 30, and severe obesity begins at a BMI of 35 to 40. The significance of severe obesity is that it shortens people's lives, and it decreases the quality of their lives. It shortens their lives because they start developing other diseases that are caused by the obesity. Things like diabetes, high blood pressure, stroke, sleep apnea, and these are things that kill people.
We had an opportunity to visit with one of your success stories, one of your patients, Shalay Benson.
Hi, I'm Shalay Benson. Starting about 5 years ago, started noticing I'd kept weight on and hadn't really worked to get it off. I was okay with it, comfortable. And then, your kids start school and other kids are mean and start saying things to attack them using me as their object. I wanted my kids to feel good about themselves and about their mother. I took measures. I went to a seminar. I heard about Dr. Boyce. First went there to consider lap band and actually changed my mind to do the Roux-en-Y because I was wanting to lose so much weight. Went to Dr. Boyce, talked to him, studied. He made sure that I had information to make, my decision and make the correct one, and he helped me with that. Had to go through classes. That way I was educated on how to take care of myself afterwards and to know what I was really going through and what the surgery was about and what it was doing. After my surgery, I did well. I lost 180 pounds. It took me about 11 months. My son finally got to put his arms around me. He said, "Mama, my hands fit around you." And just, it broke my heart to think that I let myself get to that size and not taking care of myself and teaching my children it was okay to be obese and sit around and eat potato chips on the couch all the time and not even thinking about it because it just becomes your everyday life, and I was comfortable in it. But it was giving a bad example to my children, to my family. And now Dr. Boyce, we go to seminars, we go to support groups. You still continue to go to the doctor's office. They check with what you're eating. They try and give you advice on different things in your life. Even a psychologist is available to talk to you if you're having problems in your life. I've never, been one to worry about it, but now that I've lost my weight, I am very grateful to Dr. Boyce and the information and being able to make this change in my life.
How does the weight loss surgery actually work? Because I understand that it can involve the small intestine or the stomach. Is that correct?
That's correct. That's correct. Generally we sort of classify these operations based on how they work. So there's a group of operations that we call restrictive operations. Those operations typically just involve the stomach, and they're designed to kind of limit how much food a person can eat at one time. The malabsorptive operations, those really primarily involve the small intestines and bypassing parts of the small intestines so that patients don't have time to absorb the calories and nutrition. And then there are some operations that we call mixed, and they have a bit of restriction and a bit of malabsorption built into them as well.
Let's talk about, like anything else in life, when you're considering a major surgery like this. I guess you have to consider the pros and the cons. What are the pros?
Well, the advantages of weight loss surgery for the severely obese patient is that it's really the only thing that's been shown to provide lasting weight loss for the severely obese patient. My patients are capable of losing weight, and they lose it all the time. Problem is, if they lose 50 pounds, they often gain back 60. So it's the keeping the weight off that seems to be the problem. Weight loss surgery provides them a tool that allows them to lose the weight and keep it off. And so when they're able to do that, then those associated diseases like diabetes and high blood pressure and sleep apnea go away. And they no longer have them, essentially. And patients will actually live longer, and they're freed to be able to do the things that they want to do, whether it's get on the floor and play with their grandkids, or chase their kids around the ballpark on the weekend, or travel, or just whatever their goals are. It frees them to be able to do those things.
And what are the cons? Obviously, there are some.
Sure, the cons are the risks of complications, okay? Because there are potentially serious and life-threatening complications that can occur. So in every situation, we're weighing the pros and the cons for that patient. If the risk of the surgery is greater to the patient than the risk of remaining severely obese, then we shouldn't do the surgery. If the risk of the surgery is less than the risk of remaining severely obese, then we should do the surgery.
So in most cases, do the pros typically outweigh the cons?
I would say in most cases they do. There are very few patients who are just a prohibitive operative risk. But if you have a patient with heart disease, we have to consult the cardiologist to determine what their risk is. If they come back and say, oh no, this patient's a prohibitive risk, then there's really nothing we can offer them from a surgical standpoint. However, most of the time they're much in favor of it.
Like any major surgery, there has to be some side effects involved in this. What are the side effects that a patient may have?
The prominent ones depend on what type of surgery they have and whether it's restrictive or malabsorptive. For example, a restrictive operation will give people some difficulty eating solid foods, and there will be some foods that they just can't have. The gastric bypass, for example, has a side effect of the dumping syndrome, which if patients eat real rich fatty foods or sweet sugary foods, they may have nausea and cramps and diarrhea. Mm-hmm. So there are, I would say, procedure-specific side effects.
Let's talk about statistics. When you talk about weight loss surgery, men versus women, who typically needs the surgery most?
Well, I don't know if I can answer that, but I can tell you that about 80% of our patients are women and 20% are men. I think there are a lot of men out there who would qualify and benefit from the surgery, but for one reason or another, they don't seek it out. Maybe they're not interested in it, they don't feel like maybe they're a candidate or what, I don't know, but predominantly most of our patients are women.
Now you mentioned the BMI a few moments ago,
yes.
Body mass index.
Yes.
And again, what percentage would your what is the body mass index, first of all, and what percentage would you expect a potential patient to have?
Okay. The body mass index is a calculation. It's based on how much you weigh and divided by how tall you are.
Right.
Okay. So our average body mass index in our practice is around 50. Okay. But a patient's a candidate for weight loss surgery if their BMI is 35 or greater.
Wow.
So a BMI of 40, for example, equates to being about 100 pounds over your ideal body weight.
What lifestyle changes are involved once you have the surgery? Because I would think that has to be something that's permanent.
It needs to be permanent. We've all heard about patients who've had weight loss surgery and regained their weight, right? Mm-hmm. And that usually happens not because of a failure of the operation, but because of failure of the patient's behavior. So the lifestyle modifications that are necessary is we're going to have to change the foods that we choose to eat and how we eat. We need to become a 3 meals a day person, breakfast, lunch, and dinner, with minimal snacking. If we snack, it needs to be a healthy snack, fresh fruit or something like that. And then we need to have regular, moderate activity. Those are the real keys. And the patients who successfully do that and maintain that lifestyle do not have weight regain.
There has to be a point when a patient comes to you and you have to tell them, not having the surgery is going to put you more at risk than if you actually have the surgery.
Sure.
When is that the case?
Well, as far as when do I have that discussion with them,
right.
We'll often have that discussion at the initial consultation when I'm meeting with them, realizing that on average a patient has been considering surgery for about 2 years before they come to see me. This is really, in their minds, often a last resort. They've exhausted every other avenue of treatment and attempt before they'll come in.
Let's talk about some of the changes that you could make on a daily basis. When I was researching it, it kind of gave reference to the old adage, an apple a day.
Sure.
How important can that be?
Well, I think, it's the idea of having fresh fruit regularly, daily, 1 or 2 portions of fresh fruit, having healthy colored vegetables, green, yellow, red, orange, and lean meats. That's what we want our diet to consist of. We need to stay away from the fast foods that are high in carbs and high in fats. Eating healthy, I understand, is actually more expensive and it's more trouble. It takes more time to prepare, right. But that's what our bodies need. And if we want to change our bodies, then we have to change the way we're doing things.
And we also, I guess, should watch what we eat in the evening at a certain time.
Yes, absolutely. We should be breakfast, lunch, and dinner. We don't need midnight snacks. We don't need to be snacking on high-carb snacks in front of the television while we're winding down at the end of the day. You know, we really need to limit the snacking. You need to consider that almost every bite you put in your mouth has about 25 calories in it, so it adds up really quick.
Let's talk about sweets, because everybody wants that piece of pie or cake, and
Yeah.
I guess moderation.
Yes, all things in moderation. You know, I tell my patients even after surgery, it's not that you can't have cake or even a glass of champagne at your anniversary and you're going to go out and you're going to celebrate. Fine. Anniversaries come up once a year. You know, those types of things cannot be a weekly thing or a daily thing. We can't have pie after every dinner. You know, it's got to be the exception rather than the rule. The key is moderation.
I wanted you to talk about both ends of the spectrum here, because every surgeon wants to be successful.
Sure.
But let's say that you have, what is the best case scenario when a patient comes to you? And then on the other end, what can be the worst case scenario? Because this is major surgery.
Right, for the patient.
Right.
Right. Well, the best case scenario is you have a patient who has really thought about what they want and is willing to commit to the lifestyle changes and the long-term follow-up with me and my staff. It's very important that they do that. We're there as a resource for them to help them stay on track and to get healthy and live longer and have a more full and productive life. The worst case scenario is someone who comes in already making up their mind that this is a quick fix and I don't have to change anything and I'm just going to have the surgery and everything will be fine. It's going to magically correct everything. That doesn't happen. It does not happen that way. And that patient is setting themselves up for failure. And I feel like they're exposing themselves to all the risk without any potential benefits, and that's the worst case.
What about complications? That could be...
Sure, and obviously complications are a part of any type of procedure that we do. And the patient has risk whether we do the surgery or not. But the risk of serious surgical complications are definitely there, and sometimes patients can die after surgery. You know, I think the most common complication that they have that might result in death is going to be a blood clot. Patients after surgery can sometimes get blood clots in their large veins that if they break loose they can float up and block the heart and cause sudden death sometimes.
I read somewhere that weight loss surgery patients are 80% more likely to get divorced. Why is that?
I don't know. I think divorce is very, very common in our society. About half of marriages end in divorce. And I don't keep a statistic like that on my patients. However, I do hear sometimes that they've gotten divorced. I can't imagine that over 50% of them are getting divorced, but I don't really know. I think that there's a lot of different nuances that go into relationships in terms of who has the power in the relationship. Usually in relationships at any given moment one person has more power than the other, and maybe it alters that type of a relationship in a way that is no longer going to allow the relationship to be successful. I don't know.
So an educated patient is probably the best patient.
Yes, education has to be the cornerstone of any successful program.
So if somebody is looking to maybe have the surgery or something, what do they need to know?
Well, they need to know, they need to educate themselves as fully as possible about who they want to take care of them and what the potential risks are and what their realistic options are. Sometimes patients will come in for a consultation having in mind an idea about which one they want. And I think that's great, but it's important to keep an open mind too, because what we want to do is have an opportunity to pick the option for them that gives them the best chance of long-term success.
So the healing process, if they've had the weight loss or bariatric surgery, how long is that? Does it vary from patient to patient? Is there an average?
Well, certainly patients have different degrees of risk and different medical conditions beforehand. However, laparoscopic surgery has really revolutionized the healing process. We don't have massive wounds to heal after surgery, so generally patients are only in the hospital for a day or two after surgery. They're generally returning to office-style work within 2 weeks and have no physical restrictions after 4 weeks. So the limitations are relatively minor due to the laparoscopic approach.
Somebody loses a lot of weight. We met one of your patients who lost 180 pounds.
Yes.
What type of immediate life changes do they have?
Oh gosh, they'll have immediate improvement in their breathing. They'll have improvement in their diabetes if they suffered from that before. Musculoskeletal complaints go way down. They'll have greater exercise tolerance and activities. Libido increases. You name it. It's hard to find anything from a medical sense that significant weight loss doesn't improve.
When a patient comes to you, typically, what is the first thing they want to know? I mean, obviously there's a lot of excitement because they're thinking this may be my miracle fix. What's usually the first thing they want to know?
They often want to know whether or not they're a good candidate for it or not, and then they want to know which one would be best for them.
Very interesting. Let's talk about skin grafts, because if someone loses a lot of weight, that may be something they need.
Right. Many of our patients, even at their initial consultation, one of their primary concerns is what do they do about the excess skin and how do they avoid that? Well, the best thing that they can do is do the things that we know are supporting good skin health. Don't smoke, stay out of the sun, have good nutrition, stay hydrated, and take your vitamins. But if you lose 200 pounds, you're going to have some sagginess to your skin. The skin only has a certain amount of elasticity. So some of the patients will seek out skin removal surgery after they've lost their weight.
I know that the first weight loss surgery was completed about 40 years ago. What has happened over time? How has that evolved? And I guess a two-part question, how have you seen it evolve in your career?
Right. I think gastric bypass was first done about 1966. I've been performing weight loss surgical procedures for 22 years now, and it's been a dramatic change. The oldest operations, the gastric bypass and the duodenal switch, have been around for decades, but they were really out of favor back in the 1970s and 80s because of the high risk associated with it. So we saw a migration towards what we call restrictive procedures, gastric bandings in particular, because they were deemed to be a lot safer. But then over the years, they were safer, but they were not nearly as effective. And then the laparoscopic revolution came about, and the ability with the development of excellent scopes and tools to use laparoscopically, we became able to do these much more sophisticated operations laparoscopically with better safety and better results. And then the Centers of Excellence came around about 2005, and that really raised the bar for everybody. Over that 20 years, we've had a massive accumulation of data, and so that the clinical and medical benefits of weight loss surgery are unrefutable anymore. It used to be considered a kind of a side thing that not very many people were doing. Nobody believed in it. I once had one of my partners tell me that what I was doing was committing malpractice. Yeah, and so certainly societal opinions and things like that have changed over the years as we've learned more and more about the benefits of weight loss surgery.
Let's talk very quickly about the process. Someone comes to you for the first time.
Yes.
They are educated or maybe they are not. What do they actually go through until they get the end result?
Right, we first require some type of educational seminar where they're introduced to the risks, the benefits, and the options. And then they have an opportunity to come in for a consultation where they'll get more education, have a physical exam, and have a dialogue about what medical clearances they might need, cardiology, pulmonology, etc. And then we'll discuss the different operations. Then they go through a extended dietary phase, maybe 6 months of medically supervised dieting. Then they'll go through a preoperative education class that's about 4 hours long, going over nutrition and exercise. They take a test on that material at the end of the class, and then they receive a copy of everything that's covered so that they can review that. At that point, they're pretty well educated on what the options are, the risks are, and what is expected of them, because they're part of our multidisciplinary team.
Right.
I've got my job, the dietitians have theirs, exercise physiologists have theirs, and the patient has their job. I like to tell them that everybody has a job description. If we all do our part, we'll have excellent success and low risk.
Excellent. So someone watching right now, very interested, a little reluctant, what would you say to them that would maybe inspire them to learn more or possibly become a patient?
Sure, I would say to learn more and find out whether you're not or whether or not you're a candidate is just talk to your physician. But as far as the whole process goes, our patients are often at the point where they feel like there is no hope because they have tried everything to lose weight. But there is hope. There is a solution that is safe and has been proven to be of benefit and works. Okay? I would recommend that you seek out a board-certified surgeon and somebody who's practicing in a center of excellence atmosphere.
So when patients like Shirley Benson come back to you, it can be pretty inspiring that you played a role in that.
It is so rewarding just to be part of it.
Thank you so much for talking with me.
Oh, thank
Very
you.
interesting.
Thank
Appreciate
you.
your time.
Thank you.
In addition to what you've just learned, Dr. Boyce also told me that only 1% of those eligible for weight loss surgery each year actually elect to have the procedure. It was a real pleasure to visit with Dr. Boyce. He not only takes pride in being a successful surgeon, he also enjoys seeing his patients' quality of life improve. Thank you at home for joining us. Up close, I'm Chris Williams.
Up Close with Chris Williams is presented by Tennova Healthcare, with 6 hospitals and more than 1,000 dedicated physicians. For more information, tennova.com.